This evening we're going to be chatting with Dr. Rasheedah. Please pronounce your surname. If I don't.
Ayandipo.
Ayandipo. Okay. Oh, okay. Hi. We're going to be talking about breast cancer. Many of our followers will be wondering, why breast cancer? Why talk about that? Well, first of all, October is Breast Cancer Awareness Month, and Ayandipo is basically for moms. So we would be talking about. It'd be good for us to talk about, health issues that affect moms. I personally lost someone this month, a very dear friend of
Sorry
mine,
about that.
breast cancer. Yeah, and she's just like 2 years older than I am, and she has two small kids and a husband, and so it's going to affect them, obviously, their lives
Yeah.
and their family. The impact is so devastating, and
Mm-hmm.
obviously this is someone who was in the best years of her life in terms of working capacity and all that, and
Yeah.
let's talk about the amount of financial the
Strain.
financial upheaval. Yes,
Yeah.
getting ill can actually make you poor. Like,
Yeah.
if you think you're comfortable, just ruin your life.
Mm-hmm.
Yeah, so that's those are the reasons why we felt it very important. And Rasheedah she's very passionate about women's health. If you've been following her page, you'd see that she does a lot of posts about you're more or less like an aggregator, like
Mm-hmm.
getting moms to um, sharing information with them about resources and things like
Mm-hmm.
that, which is actually the most practical thing to do, as opposed to just giving them,
Yeah.
yeah, just telling them basically where to go, what to do.
Mm-hmm.
Yeah. So hi Bookmash. Hello everyone. Thank you so much for joining in. Please, if you have any questions, you can go ahead and ask, and then I'll note them down, and at the end or like in between, we'll just go through it. So Rasheedah, please could you just give us an overview about breast cancer?
Okay, so I guess I'll just start with talking about what breast cancer is. Well,
Yeah.
cancer, first of all, is basically like an uncontrolled growth of cells, or uncontrolled multiplying of cells, which can be dangerous. I think that's the most simplistic way to talk about cancer. Breast cancer obviously is cancer that then starts off in the breast tissue but can progress to other parts of the body. The current, I guess, the lifetime risk for every woman in the world is 1 in 8. So if you live long enough, if something else doesn't happen to you, you have a 1 in 8 chance of having breast cancer in your lifetime, which I think is quite significant for every woman who has got breast, that we all do. Men can also have breast cancer, so it's not just limited to women. However, that risk is reduced, so down to about 1 in 1,000 men, roughly.
So they
At
have
the
less breast tissue. Why
Yes,
is that though?
because they have less breast tissue.
And then the
But
hormones.
yes, exactly that. The reason why I think is more pertinent to Nigeria is compared to developing countries is because I think some developing countries have like fail safeguards in place. So they have like a national screening program where women over 50 years old will have annual mammograms, which are scans to check for breast cancer. But in Nigeria, the statistics are quite disheartening because about 50% of women are presenting in late stage breast cancer, which then limits their response to treatment, how they will cope with treatment, if they will actually survive and recover from the cancer. So it's a big thing, and it's worth talking about, not just in October, but all the time.
Yeah. Yeah. Okay. So could you just I don't know how you could just dumb it down a little bit, but just like give us an idea of the types of breast cancer and what could predispose a woman to having breast cancer.
Um, so I think that perhaps talking about the different forms of breast cancer, I think might be too complex. Then
Technical.
I will start to talk about, yeah, you understand. I'm going to start talking about all the different things that exist inside the breast. Now, I don't want to
Yeah.
confuse people. There's breast cancer and there can be 4 stages. I think that's the easiest way to kind
Okay.
of look
All right.
at it.
Yeah.
So the first stage of breast cancer is where the cancer is limited to just your breast. there's a lump and it's just in your breast, it's not gone anywhere else. Stage 2 is where actually the breast has spread to lymph nodes, which are glands that are in your armpit on the same side as that breast.
Drain that area.
Yeah, that drain that area. Stage 3 is when it's actually spread not just to the breast, the lymph nodes, but also around the breast. But it's still limited really to around the same area, but has gone above the breast, beyond the breast rather, is the right word to use. And stage 4 is where the cancer, like I was saying, has spread to other organs. So it's gone from the breast maybe to brain, maybe to bone. It's gone to different parts of your body. And this stage is a difficult stage for treatment to work. It's usually one of the stages that's kind of associated with death due to breast cancer, because by this time the cancer has spread to different organs and it's kind of difficult to treat that. In terms of risk factors or things that can predispose a woman to breast cancer are things like hormonal therapy, which is not one of the biggest. I think the biggest is actually family history. So if you have a family history of breast cancer, I'm talking about in this case first degree relative, but that's not to say that if you have people who are not first degree relatives that you can't get breast cancer. And I guess I also should say what first degree relatives are. I mean your mother, your sister, your daughter. Even if you're a woman and your daughter has been diagnosed with breast cancer, then you have an increased risk of breast cancer. Things like hormonal therapy, like I was saying, in this case, some women who've gone through the menopause might be on hormonal replacement therapy that will help them with their symptoms. Those that can predispose them to breast cancer. Things like hormonal contraception, there's a small risk associated with that, but actually that I know a lot of people will come at me and say, oh, so I shouldn't have hormonal therapy. But actually, studies have shown that in cases where that risk is there, once you stop taking that hormonal therapy, after a few years, your risk actually goes back down. Which other things like smoking, certain genetic factors, which
like the gene,
genes, the BRCA genes that some people might have heard of, 1 and 2. If you have those genes, you're more likely to get breast cancer. What are the other things? If you have had a lot of periods, if you have had periods where if you've had kids and you haven't actually breastfed. So I'm not saying not breastfeeding is going to give you cancer. We just have to clarify that. It's been found that breastfeeding is a protective factor. So if you've actually gone through your lifetime as a woman and maybe you've not had many children or many pregnancies, and then you've now not breastfed, then they found that women who have done the opposite actually have protective factors for breast cancer compared to women who haven't. I think those are the main ones. I don't know if I've missed any.
I wanted to stress, obviously, women who have to have IVF. And then I know, I was just wondering, now you know there are different types of hormonal contraception. There's contraception that's mainly estrogen, there's a mix of estrogen and progesterone. So is it like what's that thing?
The
combined therapy is safe, but then unopposed estrogen is what's
that's the one that's actually associated with a high risk of increased risk of breast cancer.
Okay, so what about okay, when you say woman having late menopause or early menarche, so you've had a longer duration of being exposed to
estrogen, basically.
estrogen.
So the risk factor is basically the duration of exposure to estrogen. Estrogen is the main culprit, I guess to say, is the main one that's kind of indicated in increasing the risk of breast cancer. So the longer that you are exposed to estrogen, the higher your risk of breast cancer.
Okay, so there are 2 questions. Let's just take those quickly. Someone asked, what about if the person's father had cancer? Does that predispose you to breast cancer?
It depends on what cancer the father had. So if the father had breast cancer, then yes, that would increase your risk because you've got a first degree relative who had breast cancer. So I would say that every member of the family is at risk, men and women included in that family, then would be at risk. But if it was a risk, if they had other cancers, then your risk will be higher for that particular cancer that your father had, and then you would then have the general risk that the other population will have with breast cancer. So your risk will not be greater just because your father had some other type of cancer.
Yeah, and then someone just asked also that this thing with contraception, yes, oral contraceptives or emergency contraceptives. Postinol too is actually progesterone, isn't it?
Yeah, two is
Yeah.
progesterone. So that
So
wouldn't increase your risk of breast cancer. But can I just say that frequent use of postinol is not advised anyway.
yes,
So
yes,
whoever's posted the question, I just wanted to address it because it's one of my pet peeves.
yeah,
I always want to not get. I just thought it'd be good to talk about it on this as well. Postinor to ladies should not be used as regular contraception. It is not
yes,
meant for that. It can
yes,
cause future problems, which I'm not going to go into. But I just wanted to
yes.
clarify that it is not a regular means of contraception. If you find that you're using Postinor 2 regularly, then I think you need to be speaking to a doctor about getting some sort of longer term contraception.
Yeah, to have a plan because it's
Yeah,
supposed to be emergency.
exactly. It's only
Yeah,
for emergency.
yeah, and then relying on it also. Anyway, let's not go into it.
Yeah, I know.
Okay. Yeah. Oh, so sorry, Sarah. I'm going to record this and then I'm going to put it up on our YouTube page. So don't worry if you don't get everything. Okay, so now let's talk about treatment.
Hmm.
What are the treatment options for breast cancer?
So, treatment modalities, I think, are very determined by one, how advanced the cancer is, two, how sensitive or what sensitivities that breast cancer has. So, say a breast cancer has a certain genetic makeup that will respond to certain therapy, then you will treat it differently. The other thing is how far the margins of the breast cancer are and how it's spread. I'm talking more in terms of the surgical treatment.
Yeah,
The other thing is also how well you are as a person, so how fit you are to undergo
yeah,
treatment, and also finances, because we have to address that in this country. It's not like someone else is paying. You're going to have to fund this, especially if
out
you're
of
in
pocket.
Nigeria.
Mhm.
So it will be one will be surgical, so it would be the remove the cancer. But most women frequently would then go on to have either chemotherapy or radiotherapy or even both. And then it doesn't just end there. So it's not a case of you will just have surgery, radiotherapy, chemotherapy. There is still aftercare. And I think the reason why I'm talking about this now, even though you might be cancer free at the points after your treatment, it's very important to still have regular checkups afterwards and follow up, because women who have had one breast cancer before are still at risk of having another breast cancer come back. So you still have to be still on watch or alert and have regular follow-up. Not to say that you will have breast cancer again, it's just that there's that risk there and you still need to have aftercare.
Yeah. Okay, so just before I answer, I tell you this next question someone asked. I want you to stress on how the cancer spreads in terms of how the local spread, like if you have something that's like a
Mm-hmm,
peanut and then it
mm-hmm,
spreads in terms of it gets bigger within that
mm-hmm,
space. That's a
mm-hmm,
local spread.
mm-hmm.
Whereas also it could also spread through the bloodstream. That is how it gets
Yes,
to the liver. That's how it
yes.
gets to the bones. That's how it
Mm-hmm,
gets to the brain.
mm-hmm,
And then also like bloodstream also, and then lymph, which is
mm-hmm,
the filtered blood that also
mm-hmm,
circulates around the body, just
mm-hmm.
so that everyone understands. And then also that sort of spread also informs how it's treated in terms of like surgeries to remove something that is localized. So if
Polarized,
the
yeah.
cancer is gotten early, then and then it hasn't if it's gotten early and hasn't well, if it's gotten early and it's just like sort of localized, they would take a section of that tissue and then also try and make sure that the part what they took has free edges, that's like there's no cancer,
Mm-hmm.
you know, pieces, speck seeds around and all that. And then
Mm.
if it's spread, that is
I think
obviously okay
let's just draw a picture,
advanced.
because Eddie
Yeah.
has just explained. She's answered the question herself. She doesn't need me to
if
answer it. So let's say, can you see that?
you brought it closer, I think it would be clearer.
Can you see?
Yes,
So let's say that's a cancer. That's that little circle in the middle
yes,
that I have.
yes.
So if they were going to do surgery, they would often do. something like that, and create wide
Yes.
margins around,
Yes.
because they want
Yes.
to make sure, because cancer cells are we can't see them, but
Yes.
surgeons will try as much as possible to take more
Everything
than is required so
around.
that they're
Yeah.
catching every single thing. And even after that, just to be certain, women will then still go on to have chemotherapy or radiotherapy to the breast to make sure that every cancer cell around there
Yeah.
is killed, and
Yeah.
they can be sure that they've gotten everything.
Yeah.
Does that make it a bit
Yeah.
clearer?
And then
Um,
also some moms go on to have because of cosmetic reasons and also people's confidence, they can have prosthesis, they can have breast implants as well. So
yeah.
yeah. Okay, so please I'll let you continue. Um
Um, So we've talked about it. So it'll be depending on how the cancer is spread. And Eddie already said that it's spread by the lymph and spread by bloodstream, and that's how it gets to further organs. That, like, you'd be wondering, how can the cancer in my breast get to my brain? Well, that's how it will get there. And surgery will be, usually sometimes if they're going to take out the breast, so if they find a lump, usually if it's spread, so you're stage 2, like I was saying in the beginning, and it's gone to the lymph nodes. Lymph nodes are basically like glands that help filter the blood, basically.
yeah.
And we have them different parts of our body. We have them in our armpits. And if you have breast cancer, the first area of spread usually is for it to go into the lymph nodes. If you have breast cancer in the lymph nodes, it would normally be that they would take out the breast cancer, have a mastectomy, which is where most of the time they'll take out the breast or a lot of the breast tissue, like we're saying, to create wide margins, and they'll also take out the lymph nodes in that area, just to
Oh,
make sure that they have everything.
okay. So now this question that was asked by Benedicta is going to
Mhm.
lead us to the next point. She's
Mhm.
asking, what about untreated boils, in bracket abscesses or cracked nipples, being a risk factor?
As far as I'm aware, untreated boils, abscesses, and cracked nipples are a separate issue, and they don't
Yeah.
particularly increase your risk of getting breast cancer. There's no, they're more to do with infection in the breast, and infection is different from breast cancer. They're not the same thing. They're not the
So now
same
that,
thing.
yeah, okay, sorry. So that leads me to my next question, especially because of the sort of information, the sort of page that I have, which is mainly focused on breastfeeding mothers. How do you differentiate from one, a benign lump and a malignant lump, and then two, there's certain things that come with breastfeeding, such as galactosills, such as engorgement, the features of engorgement. How do you differentiate between that and a breast cancer?
Okay, so in the context of a breastfeeding mom, if you're breastfeeding and you've ever breastfed, and if you've never breastfed, your breast will feel lumpy.
Yeah.
If you've ever breastfed, you'll know that your breast will feel lumpy. Your breast will have occasional engorgements, and like Eddie was saying about the galaxy cell, they're just basically um, more like a blocked dot that has some milk in it, and is basically due to blockage in the drainage of the breast milk. Nothing to do with breast cancer. Usually lumps like this with breastfeeding moms, you have to be careful. So I don't want every breastfeeding mom running to the doctor to say I have a lump, because your breast will be lumpy. The only thing I guess you have to look out for is the lump persisting? Are you having other symptoms alongside the lumps that you have in your breast? And by other symptoms, I'm talking about pain. So you will get some pain if you're breastfeeding, and it's you're engorged, but that pain should settle. It shouldn't be a persistent type of pain, and you shouldn't be discharging anything else besides breast milk, unless you have a reason for you to have blood in your nip. So maybe you have cracked nipples, you might have a bit of blood, but I'm talking about blood within reason. So if you're having frank blood into your breast milk anyway, I think you should be having it checked out, because it could actually be mastitis, but it could be something else more sinister. So I would say that if you were having other symptoms besides a lump, and a lump that is not resolving, so usually if you have engorgement in your breast, it should normally settle. Like, what if you pump or once you breastfeed, your breast will change. But if it's a lump that I think personally, I would say to a mom that if you're feeling a lump that's persisting more than a week, because usually symptoms of engorgement or galactosyls and things like that should settle within that time frame. And if it's persistent and it's not even changing in consistency, so if it was a breastfeeding lump, it normally will change depending on how much you've breastfed or how much
Or
milk
pump
has
out,
come
yeah.
or pump out. So it will change. It won't just stay the same fixed size lump and not change or respond to anything you're doing. So I guess, and the thing and my
You
fear,
don't want to make
however, is,
people
yeah,
too sensitive.
my fear is either going one way or the other, making people too sensitive or making people hypersensitive, where they're just saying everything that is in their breast is just down to breastfeeding. Because actually, I've known cases where breast cancer has been diagnosed whilst a
Yeah.
woman is breastfeeding.
Yeah, my friend, that's actually what happened to my friend.
Exactly. So the thing I would just say is, if you've picked up a lump or your breast feels lumpy, do all the other things, keep breastfeeding. And I mean, you're the breastfeeding specialist, but personally, having gone through breastfeeding myself with 2 children, I would say that lumps associated with breastfeeding tend to settle. They never persist for more than a few days. So if you're having a lump that's not changing in size, in consistency, you have other symptoms like you're having frank blood in your breast milk rather than, or you're having pus or anything like that, just have it checked out. Just have it checked out. Any other symptoms, just have it checked out. It might be nothing. It might be maybe just a simple infection, maybe due to cracked nipples, and something that just a little bit of, rest or warm compress or maybe a tiny course of antibiotic will solve. But it might be something sinister, and I don't want people to not
To
react
become
because
too
they just think, oh,
sensitive.
I'm breastfeeding. Yeah.
Oh, okay. So now, now I'm thinking about an abscess. An abscess will come with a fever. So, but
Yeah.
then, are there cases of people who've had lumps that were cancerous that had fever? That wouldn't happen, right?
Um, So, one of the when you taking like a general medical history as a doctor, you would normally say, "Are you having night sweats? Or are you losing weight?" Those are
Yeah.
kind of one of the hallmarks of malignancies. So, a fever is different to having sweats at nighttime. Those are
Yes.
two different. So things like mastitis or infection in the breast or abscesses will come with fever, will come with maybe discoloration of the breast. At this point anyway, as a mom, I would expect, a breastfeeding mom, I would expect that you're having it looked at by someone, because I think that this is the point where a specialist needs to be telling you what they think,
It
assessing
is.
you first of all, and then telling you, not just you self-diagnosing that, oh, because I have a fever and it looks a bit red, I have an abscess. We don't know. We really don't know. And I would think that as a mom, at this point where you're having fever, where maybe your breast is looking a bit funny, or you're having discharge or pus or anything like that, I think that you should be seeing a doctor.
Okay, so in our excitement, we actually forgot to list out the symptoms of
Yeah.
breast cancer. Please, can
I
we
like how
can
you said in
we do
our
that?
excitement.
Yeah.
Okay, so we've kind of talked about some of them. So a lump, which everyone talks about, but again, we've
Yeah.
clarified, like we said, that lumps exist and not all lumps are breast cancer. But if
Yeah.
you pick out a lump that's abnormal for you, if you have discoloration of your breast, if you have puckering of your breast, so basically where you're having like indentation or induration of your breast,
Dimples.
yeah. If you're having your breast starting to look a bit like, how the back of an orange looks, they always say it's like a powder orange. It's very complicated, but picture an orange, how the back of the skin of an orange looks. If the skin around your breast starting to look like that, if you're having any discharge from your breast, and one, you're not breastfeeding, or two, you're discharging something other than breast milk for a breastfeeding mom.
Okay.
If you're I've heard women whose lumps have been picked up because they had a change in temperature. So,
Okay.
and that's very tricky. They just And these were women who were not breastfeeding, so they had no reason for them to have an infection or anything like that in their breast. And another thing to point out is, whilst we're looking at her breast, we should also do the same for our armpits, because all the symptoms and things that I've said to look out for can be happening in your armpits as well, because your breast tissue extends there, and you do have lymph nodes there that can get lumpy. So,
Yeah.
yeah, those are, I guess, the. Have I missed out any, Eddie? Please feel free to jump in if you think there's anything that I haven't mentioned.
So anyway, I mean things like having pain, bone pain and things, that's like advanced. So
Mm.
let's just let that go. Let's just let that go. Okay. So now could you please take us through when to do breast examinations and how to do them?
Okay, so the if you're still having periods, the best time, the recommended time, not by me, but just general recommended guidelines, is that you should do you should do your breast exam 3 to 5 days after your period has ended,
Okay.
and that's just because our breasts change in terms of consistency, lumpiness, tenderness during the course of the cycle, and they've kind of general consensus is that that's the best time to do them. If you have stopped having regular periods, pick a day for ease, maybe the first of the month every month, and do it the same time every month, so that you can be comparing the same time with the same time every single month. And how to do them. So some people have said, oh, do it in a shower, do it with some massage oil, do it with water. I think that if you're new to feeling your breasts, the best, you need to start off feeling it with your bare hands, so you know what's normal for you. Because I think that by the time you start introducing other things, other elements into it, then things start to get a bit confusing. But I think if you're just starting to get to know your breast, or starting to get to know what's normal for you, the best thing is to do it with your bare hands, just for starters. And I've got breast form here. um so normally, the first thing to start off with is by looking. Some people might say feel it first and then look, but I think if you start off looking, then at least you might have picked up something that you want to explore a bit more, if you've noticed it whilst you were looking at it, and then you can explore it a bit more when you're feeling. And when you're looking for all the things we talked about. You're looking for any funny angulation of one breast. Maybe one breast is hanging slightly. Both breasts, everyone knows, but no woman has two breasts exactly the same. And if it's natural, the breasts, they're not the same and they're not symmetrical. There's a slight difference in size. But if you've noticed that there's a change that's different for you, if you notice any abnormal dimpling, like we said, any changes in the skin color, any discharge whilst you're standing, and try and do this from different angles as well. And the other thing in this advice is just to maybe put your hands on your waist as well, because that again, with the muscles, changes things as well. Then you can have a better look. And at this point, depending on what you choose to do, but I would recommend doing it lying down, just because your breast collapses against your chest wall when you're lying down, and you have, more leeway to feel things a bit better. And the advice is basically, so imagine that this is your breast. Um, the the advice is to not feel with the tips of your finger, because you're poking down and you're more likely to miss, but to feel with the pads of the three fingers, so
Okay.
that you're feeling with the pads there rather than the tips of your finger. And what you want to do is, imagine I'm lying down, is you want to feel with your finger, and you want to, so I'm doing that movement. So whilst I'm feeling, I'm kind of going underneath as well, just trying to feel if there's anything, so that I don't miss anything. And the idea is that you try and work. The way I do it, and
You
the
do
way that
your
I,
circular.
yeah, I do circular, but that's not the only way to do it. The main thing is to make sure that you cover all the breast areas and you don't miss
Don't
any
miss
areas.
any spots.
So some people might want to do this and come in, and do this and come in. So they're
Okay.
trying to do this and coming in. So doing that. And some people will work around in a circle and gradually come into the center, like that. The thing is, when you get over your nipple, so don't forget to press on top of the nipple, because there might be something underneath. And then also,
And
what
then
was
also squeeze.
yeah, so
Okay.
at this point,
Squeeze.
I say to, whilst you feel on top of it, I say to also just go underneath the nipple like that, go
Okay.
underneath it as well. And then at this point, I would then do this, where you stretch the skin, and then you press. So you stretch and you just press. That way you can see if there's actually any discharge. The other thing to just point out is, remember that this is not a real breast, obviously, but remember that you still have breasts
Breast
going
upstairs.
all the way up here. So you
Yeah.
need to remember up here, and you need to remember to also feel your armpits as well. for any
Because that
lumps or
I think I
changes.
know someone whose breast cancer was picked up as as a lymph node.
Yeah,
Yeah, yeah. Not necessarily. There wasn't any lump that they could feel in the breast, but they
yeah,
felt lymph
yeah,
nodes first. Yeah,
yeah. So
they
it's
felt
very,
lumps
very important.
in the armpit.
Armpits.
Sorry.
Yeah.
Yeah.
So it's very, very important to not miss that. And then the other thing I forgot to say was, whilst you're feeling, just make sure if you're feeling the left, this is my left breast. If you're feeling the left breast, put this hand over just behind your head, just so that you have access to all this area and you don't forget those areas. I always say when I do these demonstrations that I don't want to do it on myself, but I still end up doing it on myself. Anyway, but yeah, it's just how I get into it too much, and you just have to remember,
But I think
because I
it's
think a
better.
lot of people forget. A lot of people forget their armpits. Like, you just feel your breast, but actually your breast tissue extend here, and your lymph nodes are still in your armpit. So feel properly in there, so you don't miss anything. And just do the same for the next side.
For the other side.
Yeah.
Sorry, there are things we missed. I wanted to just highlight nipple
Mm.
inversion. That is when the
Mm-hmm.
nipple, instead of pointing out, turns
Yes.
back in.
Yeah.
Recent, because some people are born with their nipples either flat
Yeah.
or pointing inwards. But
Yes.
then
Yes.
if your nipple has always been out and all of a sudden you notice that it's pointing in any
Mm-hmm.
funny direction and then
Yes.
it's also turned inwards, that's also something that you need to
Mm-hmm.
get checked out.
Yes.
Yeah, I forgot that. Okay, so now how does a woman's breast change with age, in the sense that, okay, no, let me rephrase this question now. How we've done that breast examination every month. What are you
Mm-hmm.
supposed to do annually? What are you supposed to do every year or every other year?
Okay, so um, the older you get, the less dense your breast tissue is. So it's recommended that women above 40 have a yearly mammogram, actually, because we didn't talk about this actually. Your risk of breast cancer increases with age. So older women are more likely to have breast cancer.
Okay.
Because I think that because it's Breast Cancer Awareness Month, a lot of women might be scared and think that, oh, well, every lump in my breast is breast cancer. The younger you are, the more likely it is that if something is in your breast, it's not breast cancer. It's probably something like a fibroid, so like a fibrous tissue, or just a lump associated with your cycle,
Hormonal,
and
yeah.
and it will resolve. So the national, I guess the worldwide consensus is that over 40, every woman should have a mammogram. So, well, if you're turning 40, congratulations. But remember that as part of the things that you need to add to your to-do list is a mammogram. Because a mammogram is basically I put up a post not too long ago on my page. It's like an x-ray of your breasts from both directions, where they look at the tissue. The reason why it's not recommended for women who are less than 40 is because the breast tissue is more dense, and you're less likely to see properly what exactly is going on. So there's been a lot of times where they've done mammograms on younger women, and then they still have to do other things, like maybe take a sample of something they're not sure of, because it doesn't give a very clear cut picture, which is why the cutoff is 40. But that's not to say that women younger than 40 might not require a mammogram, or they might not recommend that they have a mammogram. It's just that generally it's not a very good test or diagnostic test to use in women below 40.
Because of the way
Um,
their breasts are.
yeah,
Yes.
because of the way the breast tissue is. And also remember, if you're breastfeeding, your breast tissue will also be different because it changes with breastfeeding. But that's a completely different conversation to have.
So who gets to do an ultrasound, a breast ultrasound?
Who gets to do it? You mean which woman should have it?
Yes, yes,
So
yes.
it normally would be something that's recommended for younger women who have
Okay.
then picked up something, or even sometimes in older women. The mammogram might be a bit, we're not quite sure, we want to do another test just to
Okay.
find out what exactly we're seeing. And even most women will still, if they found anything on the mammogram, will then still have an ultrasound scan, because if they were going to take a biopsy, they would still need an ultrasound scan to see
To guide them.
exactly, guide them so that they can take a sample of it to test. But if you're young and you've done your breast exam and you've picked up something, I think the first step will be to go and see a doctor who will then examine you again, because the chances are that lump that you felt in a week's time might not be there.
Okay. So yeah, I wanted to say something at this point. I'm always saying this to people, but maybe I've not said it enough on the page, is that there's something we do in Nigeria. I mean, outside Nigeria, medicine is no longer paternalistic. A patient comes into a consulting room, they've done their research, so they're asking informed questions and they're like really engaging. But for here, a lot of us feel that the doctor knows what's best for me. Um, the doctor knows what's best for me. I'm safe, so like I don't need to ask too many questions. I don't
Yeah.
even need to ask stupid questions and all that. So I'll just sit down there and whatever they tell me is correct and all that. So please, before you go to the hospital, do your research and then ask questions. If a doctor tells you, oh no, I don't think that you should do anything about this lump now, ask why. Because I would there's a senior colleague of mine that there was a lady who actually presented early with a lump, and I don't know what happened. Like, okay, he examined it and asked her to come back, in a few months, or I think they were supposed to have done a biopsy, something stupid and annoying concerning insurance and coverage and blah blah blah. The long and short of the story is that I think he didn't take a biopsy. I can't remember what happened, but time elapsed, and by the time she came back, it had spread. So, yes, fine. That is like obviously something that could lead to a lawsuit, but she presented at the hospital early, and she was hoping that she
The
was
doctor would
in good
treat.
hands. Yes, yes. So, I'm begging in the name of all that is good, that we stop this whole thing of just feeling that. Another thing is that sometimes people are overworked, they're tired. Is when you ask them questions that their minds like sort of
Yeah. Yeah.
they sit up and all that. So even if you know even if it's a silly, if the person knows that you know what's up, they will sit up, and all that. So I mean,
Yeah.
I'm just going to put that there. It's very, very
Yeah,
important. I mean,
I'm
people
glad
also
you touched on
compare.
that. I'm glad you touched on that, Eddie, because someone tagged me on a post this evening, and
Yeah,
I was just thinking it was something about how some herbal medicines can dissolve lumps and can flush away the cancer, which is a virus. And I at first I wasn't going to comment, but then I thought people would read this, and a lot of people trust people easily because someone is claiming to do something does not mean that you're not allowed to question things or ask, how does this work? Why do you
yeah,
think it works?
yeah,
And that should apply to your medical doctors as well. Even if someone examines you and feels a lump, if you're still not satisfied, or you feel like, I feel this lump, there's something more to it, by all
yeah,
means get a second opinion,
yeah, yeah,
get someone else to check it, because
yeah.
the more people are checking, the lesser the
Somebody will
chances of
pick
mistakes
something.
being
Yeah,
made.
yeah,
So
yeah,
I I always say this. I'm very open to people asking me questions about stuff. I never say, "Oh, this is what you should do," because
yeah,
at the end of the day, we're having a discussion, and I know what no single doctor knows everything perfectly.
yeah. That's why people specialize.
That exactly. That's why people
Yeah,
specialize. So if you're, and myself, I'm not an oncologist. I'm not a surgeon. I would never
yeah,
come and start telling you how I'm going to cut out your breast cancer. I'm just going to tell
yeah,
you just public health awareness, simple, basic information that
yeah,
you should know. And if you
yeah,
felt a lump, go and see a doctor. If the lump is still there, and you're not happy with what doctor has told you, ask them, oh, what's the timeline? How long am I supposed to wait before this lump goes away, and how long am I supposed to come back to you? So let
yeah,
there be a checking back in process. Don't just say, oh, the lump will go away. How long should I wait before this lump
yeah,
goes away? And if the lump doesn't go away within this 1 week, should I come back and see you? Are we going to do a scan? Ask questions like this, because it's your life, it's your body.
yeah,
It's
yeah.
not them at the end of the day.
Okay, so now, so what do we do when what does a woman do? Let's just go through like steps. What do you do when you see a lump? Just to summarize, when you feel
Okay,
a lump
so
in your breast
when you feel a
or
lump
notice any strange thing.
or notice any changes
Mm-hmm.
that is not normal for you, my advice is for you to go and see a doctor immediately. who will then examine you again. And if it was a lump that was suspicious or concerning or worrying, they would normally refer you for some sort of imaging. Whatever that imaging will be will depend on your age, like we were saying, so an ultrasound or a mammogram. And then depending on the outcome of that, they will then say, we're going to need to take a sample, because you need to take a sample of whatever it is before you can confirm definitely that this is breast cancer. You can't just confirm that this is cancer based on feeling or seeing a lump. So they're going to take a sample, they'll take it to the lab and see if it's cancerous cells. And then if it is cancerous cells, then they have to stage it to see how far the cancer has
What's the
spread.
staging, please? What's the
So that's the
staging?
stage that we talked about. Stage 1 is the cancer just in your breast. Stage 2 is it your breast and your lymph nodes. Stage 3 is it your breast, lymph nodes, and surrounding areas. Stage 4 is has it gone to other organs in your body, which sadly is where 50% of Nigerian women will present in. And the drive this month, sorry, I'm going to put this in here because otherwise
Yeah,
I might
please
forget to
do.
emphasize
Do,
it.
do.
The drive this month is to make sure that women are not presenting at stage 4, because stage 4 is where it becomes more expensive to treat. Women are less likely to survive. Women are less likely to actually take the therapy because it's a lot. The radiotherapy and
Yes,
chemotherapy drains you.
yes,
Surgery
yes.
drains you. It's not minor surgery. They're going to take out your breast. And stage this the drive this month, because breast cancer is here. People are saying, oh, there's preventive things, but actually, even though there's a lot of research, no one quite knows what causes cancer, what causes the cells to say at
Yeah,
this point we're going to
yeah,
become cancerous cells. No one
yeah.
has still found it out. So actually, we all need to be alert to
Woke.
it and say, yeah, exactly. We need to be woke and be saying to, okay, what am I going to do if I do my breast exams every single month and I don't miss it? The more likely I am to pick up something early, because how much can happen? Not I'm not saying that you should be blasé about it, but not very much will change in a month's time. So if you pick up a difference within a month, that's fantastic,
You're very
because it
early.
means
Yeah,
you're very, very early. You've picked up something immediately and think something can be done about it straight away. But if you're doing it 1 month, then you don't do it for 5 months, then you do it for 6 months, the more likely it is that something's going to happen. And by the time it's picked up, because actually sometimes most breast cancers will fall in stage 2. That's the statistic, because sometimes the breast cancer is so small that even our fingers cannot pick it up. But even stage 2 is okay. You can still be treated. You can have surgery, you can have chemotherapy, you can have radiotherapy. But we don't want people to be getting to stage 3, stage 4, because then it's becoming difficult. We live in a country where it's not exactly like the population is wealthy.
yeah.
And you're going to
And
be
there's only
paying.
one functional radiotherapy center in Nigeria. That's in
Exactly.
Abuja. It's
Yeah.
supposed to be UN. It's supposed to be Nsukka, Ibadan, and Abuja. I think
Yeah.
that's where the
Just
centers are,
Abuja
but
now.
it's
Yeah.
only Abuja that.
Yeah.
And another thing I want to tell everyone also is that these machines are supposed to be calibrated. I did
Mm-hmm.
a post in oncology news. They're supposed to be calibrated. When I mean calibrated, is like you're giving you some energy
Mm-hmm.
to kill the cancer cells, but they're supposed to give a particular amount of energy. If they give too little, they will not kill the cancer cells. If they
Mm-hmm.
give too much, they can end up hurting the tissue
Yeah.
around the
Yeah.
cancer cells, and that
Mm-hmm.
can cause more problems. These machines are supposed to be calibrated, and apparently there are not a lot of technicians that can do it. Sometimes they have to
God.
fly in people to calibrate these things. So what I'm just trying to stress now is um it's just, let's just try as much as possible to, if we do if we try and get it early, we may not need to
Mm-hmm.
expose ourselves to, for example, radiation,
Radiation. Yeah.
and chemotherapy.
Because
I'm just
we also
saying,
need to
yeah.
remember that radiotherapy, which is a treatment for cancer, can also then cause cancer. We have to
Yes,
bear that at the back of our mind. So even though it's a good thing in the context of cancer, in the future it could be that that's the risk factor that you've then got for a different cancer to then
for
arise,
thyroid cancer, for example.
or your
Yeah.
lungs, because your breasts are just in front of your lungs.
Okay.
So we just need to stress that.
Okay. Yeah. I'm sorry. I hope I didn't scare anybody. Sorry. Okay.
But it's not about scaring people, it's the truth.
It's
And
just
we
so
have
that
to
you know.
say it as it is. We have to say
Yeah.
it as it is. That's the
Yeah.
truth.
Yeah. Okay, so please, can you, I know we talked about this, please, can you list out the places where free screenings are being done, and where people can get screened, where people can get treated? Can you just let us know? And then if there are any
So
dates. Um,
So, as far as I know, this month a few places have organized free screening. Micure, I think the one Micure centers in Lagos have got
there's
this deal
Becky and
going on for
Oshodi.
breast screening. Yeah, Lekki and Oshodi have
Mm-hmm.
got breast screening,
Mm-hmm.
free breast screening. They're offering that this month. Sebekli, I think like an
Okay.
NGO and cancer screening center and optimal cancer
Yes.
care, I think offer free screening on certain days of the week.
Friday.
Those Friday.
Optimal.
I
Yeah.
think one of them is one optimal is Friday, but I think Seberclean might be a different day of the week. I just need
Okay.
to confirm that. But they offer free screening as well. Not
Okay.
every day of the week. There was so that's for Lagos. I put up a post about image diagnostics, and I think they're offering free screening this month as well. So if you wanted to take advantage of it and you're watching this from Port Harcourt, then they're one. Today I saw that Dr. Williams had put up a post about a screening center in Warri, which I'm going to repost because this is what I do. I'm sure people will just get tired of my
Please
repost,
tag
but
me. No, don't stop. Please
so
tag me to my report.
I'm going
Yeah.
to repost it. I was thinking I'll do that as soon as this video is over. I'll repost it. That's for women in worry.
Okay.
FBI, the Female Bikers Initiative, actually offer different rounds of free screening in different parts, and I think that they've got an event coming up in Takwa Bay. I don't know if
Okay.
it's this weekend or I think the 27th of October. I will double check that. They're having an
Okay.
event where they're going to do an awareness talk and offer free screening as well. Am I missing out any major ones that I've reposted?
Is there
FBI,
anything in Abuja?
there is. I think there is. I need to double check it, but I think they were having a walk, but I don't know if as part of the walk for breast cancer awareness, if they were going to offer free screening. I can't say over the top of my head now, just thinking
Okay.
about it. But I know that they were raising some awareness, and some people have actually offered discounts on their breast screening. So I think after the video, I will just go and repost or re-clarify, and I'll tag you on those posts.
Okay.
But other than that, outside this month, I know that it's nice to have something free. But even outside this month, even if you have to get a mammogram and you don't take advantage of the free screening this month or whatever, it's still important that you do it. I know that money is not exactly easy. These are quite difficult times for a lot
Yeah.
of people.
Yeah.
But a screen today can save you millions of naira tomorrow.
Yeah.
So I just think we need to put that on balance and think about it, that if I pay 10,000 naira today, I can potentially save myself millions of naira, because even people who are so-called middle class in Nigeria, when breast cancer comes or any kind of cancer comes, it drains their bank accounts.
Yes.
And
Yeah.
they then have to solicit for funds from family members, from people to help them. And these are people who, in quotes, are well off
Well.
or are
Yeah.
rich.
Yeah.
So
Yeah.
it's quite expensive.
Yeah.
So I think that we just have to think about not just about today, how that 10,000 naira is going to affect me today. Think about how that 10,000, I don't know how much screening costs. I'm just using 10,000 naira as a figure. I don't know how much they're offering it for, but think about how that 10,000 naira is an investment in your future health, rather than, oh, I'm spending 10,000 naira. It's so expensive. I know it's not. I'm not saying everyone is wealthy or well off, but please, if we can, it's preventing or diagnosing and picking up things early is going to save you a world of heartache and
Heartache
financial
and
heartache later
yeah.
in the future.
Okay, yeah, so I was going to add one more thing. I'm thinking also, if we can, back to engaging with our doctors. Anytime you go to a health facility, um, the people, especially consultants, who have this bad habit of, in medical school they teach you there's steps. You take your history, you examine your patient, and
Yeah.
then you carry out your investigations or whatever. So some people tend to skip the examination part,
Mm,
and it's very important. Sometimes somebody may come in with something else, and then you may pick up something minor, you may pick up
mm,
something that is. So
mm-hmm,
if you go into a consulting room to see someone about, and then you're not examined, ask them to examine you. You know, it's
Mhm.
an opportunity, especially also
Mhm.
if you've not had even if you've not also had the breast exam, ask them to
Mhm.
examine you, you know, to check
Mhm.
and all that. That's also a very good opportunity to do that.
Yeah.
Yeah. Just as in put them on the
The
spot.
other thing, the other thing that I was also thinking about, because I put up a post about it because I was
Yeah.
livid with my. So I personally, I've lost an aunt. I lost her last year from breast cancer, my mom's sister, and I sat
Sorry.
through, attended her chemotherapy sessions and things like that with her, and I think that's where my not I've been passionate about women's health, but I think that breast cancer, it took it up a notch for me, because then it's a personal thing for me, because now I have to be extra vigilant, even though it's not a first degree relative, it's that close to home for me. And I remember someone who had been diagnosed with ovarian cancer in Nigeria. She had a CT scan and it said ovarian cancer with peritoneal mets. For God's sake, it's they didn't my her family had to call me from Nigeria, because this woman was like 80 something, and say, can you please interpret a result for us? I'm like, what do you mean? So she's got swelling in her stomach and she's got bloating and she's not eating or opening her bowels anymore, and she just says she's in pain. I'm like, okay, she's at home. They're like, yeah, the doctor says there's nothing else they can do. But what did the doctor say is wrong with her? So I was quite livid, and then they sent me a screenshot over WhatsApp of, these are like distant family members, by the way, and they're somewhere in like Ekiti or Ogun State, I can't remember. And this, it said on the scan, ovarian cancer with peritoneal mets. It would have taken a doctor 2 minutes to say this to the family, because they were walking around thinking that this woman was going to miraculously recover from this illness. And then the next day, after me telling them, so I called him. I had to come out from work and call the man and say, I don't think your mom is doing very well. I don't think that she doesn't look good. This scan looks like she's got mets everywhere in her abdomen, and it looks like she's in her terminal phase.
That's
She
the
looks
cancer
like she's
has
dying
spread
away. Yeah,
spread.
she looks like she's dying. She's not eating or drinking anymore. She's not even opening her bowels. It looks like she's on her way, not in a bad way, but I had to let him know really what was going on as far as I could understand it. And she died the next day. So I was saying to them how what's the accountability system? How are we checking that the doctors are doing what they say they'll do, the imaging people are doing what they say they'll do? It just brings me back to this whole asking your doctors questions. I said the only way that the word is going to go around when people are not sticking to their professional guidelines and ethics is for people word of mouth to give feedback, because someone else then will be saved from going through the same thing, because
Yeah.
they have to be checked. This is not on, it can't be happening. This is people's lives and it's serious issues, you know. And it just, this part where you talked about asking your doctor's question, it's your right to ask a doctor about questions regarding your health. You are paying them money for that service. It's not free.
Yes. Yes.
It's not free. You're paying money for the service. The professional ethics that I know you're guided by, and I'm guided by, the way that we were trained, is that you have to be accountable to patients. You have to explain what you're doing to them. Otherwise, then it becomes, in this country, it becomes assault.
Yes.
You can't just be taking decisions about people's lives, and they have every single right to question you. You're not
Yes.
God. You're
Yes.
not God, and they're asking you, they're paying you for a service. And even myself, if I don't agree with something, I always say, oh, a patient doesn't agree with what I say to them, I always say to them, do you want to speak to my colleague?
Yeah.
Because it gives you extra assurance that someone else has looked at your
Taking
case,
a second look.
taking a second look, and then thinks, okay, this is what, and agrees or either disagrees, whatever I'm saying. But it's your right. So please don't not ask questions, because not asking
Yes.
questions and not knowing has killed some people. And,
Yeah.
it's just, it
Yes.
shouldn't be happening. It really shouldn't.
And there's no doctor, no matter how renowned they are, no matter how experienced they are, who can't make a mistake, who can't miss out something. So
Yeah,
so that whole thing of asking questions and pushing, I mean, I don't want to go into details of what happened with my friend,
yeah, yeah,
but don't no one is infallible. I mean, don't be aggressive,
no,
because that can affect the whole dynamics in the consulting room. But ask questions. Let it be an interaction, like a back and forth thing, so that the I feel that it's the experience is richer when you're actually engaging with the doctor, you know,
Yeah.
stuff like
Yeah,
that. And if
definitely.
the person is not being receptive, then you don't need to be there.
You
Go
don't
somewhere
have to.
else.
You don't
You
have
don't
to.
need
You
to be
don't owe
there.
them
There's no
anything.
sentiment attached to it.
No, it's your
You don't
life.
need to
It's
be
your
there.
health. If you're the family member of someone who's even going through this, you have every right to say to your family member, if they allow you and they permit you, that do you want us to go somewhere else and ask someone else's opinion? It's fine. You're allowed to do that. There's nothing wrong with it. No one knows everything. No one knows everything. No one can say that, oh, I've never made a mistake as a doctor. It's not,
Yeah.
it doesn't exist. So please, you're well within
Yeah.
your right to ask questions.
Yeah. Thank you so much. We have a
I got a
minute.
bit, I got a bit, I got a bit heated there in my face. I could
I know
see,
it's fine.
but
No,
it
it's
pissed,
fine. It's
it
fine.
really,
It's
really, it
fine.
really, 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 really pissed me off that time. And I just thought, how can you not know that this woman has cancer? So for months, you guys have been walking around. No one has said the word cancer.
Yeah.
And then it had to take
Yeah.
me on WhatsApp to tell them over the phone. It was first, it's not even a good way to break the news to them, but it had to be done because she sadly passed away the next day.
Yeah. Yeah. So thank you so much, Rasheedah. Thank you so much, Dr. Rasheedah. I mean,
Thank
this
you
has
so
been
much for
like
having me.
there's so many things I have to repost and write out. So please don't forget. Let us know the people who are doing free cancer
Will
screenings, and then
do, will
also
do.
where they can get um the centers. I don't know if I mean that's the thing you like doing, like centers for excellence for particular
Yeah.
ills, you know, and all that. If you can list that out so that people know, because they usually don't. Thank you everyone for joining in. We have 30 seconds left. Thank you so much for joining in. God bless you all, and thank you. I'm going to put up this on YouTube, and then obviously this is going to be available for 24 hours um after this. Thank you so much. Thank
All
you,
right.
Dr.
Bye.
Bambini and firsttimemom.com and everyone that
Everyone,
joined in.
thank you
Thank you so
guys.
much.
Thank
Thank
you.
you. Thank
All
you.
right. Bye.
Bye. Bye.